Since the magnitude of the threat from a new strain of coronavirus became apparent early in 2020, California, the nation and the world have endured a massive upending of daily life. More than 170 million coronavirus cases, a likely undercount, have been confirmed globally, and more than 3.7 million people have died of COVID-19, nearly 1 in 6 of them in the United States and more than 62,000 here in California. The virus has devastated families. The economic shock from the pandemic and the resulting stay-home orders put more than 20 million people out of work and cost more than $17 trillion in economic activity. Then there are the psychological tolls of financial insecurity, tens of millions of parents pressed into service as adjunct schoolteachers, and people enduring significant life events, marriages, births, deaths of loved ones, without the close embrace of family and friends. There is no silver lining in this cataclysmic event. But to move forward, America must recognize the fractures, weaknesses and inequalities in many of our systems. We must move from toxic individualism toward collective uplift. We need to recognize the role of genocide and slavery in perpetrating systemic racism, while also pursuing policies that help all vulnerable families, who disproportionately bore the brunt of the pandemic. We must renew faith in expertise and science, which enabled the life-saving vaccines that now must be distributed worldwide. It is imperative that the nation address, not merely acknowledge, the realities we cannot afford to ignore. There's a lot to analyze. Members of the Los Angeles Times editorial board, each of whom has expertise in specific areas, have delved into some of these issues in signed editorials below that offer insights, suggestions and prescriptions for reimagining how California and the nation do certain things. A major lesson driven home by the pandemic is that our economic system disproportionately rewards wealth while treating workers as disposable parts of a business plan rather than as people with inherent dignity and value. Our unemployment insurance system needs to be broadly rethought, and instead of doling out fractions of income to those thrown out of work, we should devise plans to help businesses keep workers attached to their jobs during short-term downturns while better positioning workers whose jobs are gone for good to pivot to new hiring opportunities. About half of Americans get their health insurance through their employers, feeding a system of vast inequality and leading to a dark irony of the pandemic. Millions of suddenly unemployed people lost the employer-provided health insurance they would need if they caught the virus that tossed them out of work in the first place. Universal coverage is essential, though we recognize that getting there will require moving through a particularly thorny political briar patch. The state ought to at least start by offering a public option for health insurance.